sometimes it's as simple as just listening to people talk. You know, if you listen to their history, if they say they have a strong family history of allergies, which certainly increases your risk of having allergies. If they have asthma, you know, other diagnoses which can be associated with allergies, eczema, things like that. And then, I mean, the classic ones. People do frequently come in with the classic symptoms of itchy, watery eyes, runny nose, sneezing, congestion, all the things that we think of when we think of allergies. And so just listening, but some of the other more common ones that we see is, you know, scratchy throat, ear pressure and fullness, you know, things like that can all be symptoms of allergies as well that we also see. Then, of course, you move down that road of testing. So ultimately, testing is a wonderful tool to figure out what you're allergic to see if there is any chance at avoiding it, which isn't always the case. But also, the testing gives you an idea of how severe the allergy is. It's not perfect for that, but it gives you a starting point for that to determine whether or not, hey, maybe we'll get by with just medicines, or no, this person needs allergy immunotherapy shots or allergy shots or drops. And so it gives us an idea of that. But ultimately, it comes down to allergy testing. Allergy testing is either a skin test or a blood test. We do the skin test most often because it's the most sensitive indicator of our allergies. It picks up on them more accurately than the blood testing does frequently. But if there are various reasons you can't have a skin test. And so if you can't, then you can actually do a blood test as well for it, which we can use to start any sort of treatment that we would need. We generally don't test kids under the age of 5 too often. The skin testing can be somewhat potentially inaccurate under the age of 5 based on older studies. Plus, most of the time, we're probably not gonna be injecting kids or using those things under that age anyway. Depending on the scenario. Now, if it's really severe and parents understand all the risks that go into it, which again are low, but they understand it, then we might shortly before that age, but right around age 5. 5 and above is what we typically test and talk about treating.